This is the MRI Gallery. The MRI scan shows the anatomy of the brain in ways that were never seen before. One can see the gray matter, white matter, sulci, gyri, nuclei, and such with a 1 mm resolution. The MRI can be weighted according to relaxation times. In the T1 weighted image, the ventricles are dark, the gray matter is gray, and the white matter is white. The T2 image is just the opposite, with the ventricles white, the gray matter gray, and the white matter dark. The two things are like a picture and its negative. Certain things are seen more easily in T1 images and others in T2 images. Here's a T1 weighted coronal MRI image of a brain with a tumor. This is a glioma that sits in the tectum. The tumor is white compared to the brain, indicating swelling of the brain around the tumor. It is difficult to see where the tumor starts and where it ends, suggesting that the tumor is infiltrating into the normal brain tissue. This is a T1 weighted MRI of a metastatic tumor to the brain from a lung. This picture is an axial view, and this image is a coronal view. The tumor is well circumscribed and looks like it is pushing the brain tissue out of the way instead of invading through the tissue. As a single lesion, this tumor could be operated on prior to further treatment. This next image shows a coronal T1 image of a stroke. The stroke doesn't look like much on this T1 image, but when given contrast, the area of the infarction does light up nicely. Here is an image of an AVM, an abnormal tangle of blood vessels, on the right side of the image. Since blood travels through the vessels, when the magnet lines up the dipoles and then records the relaxation time, the blood that was magnetized is no longer in the vessel, but has moved through the vascular system, so blood vessels tend to show up as black spots. The MRI can be used to image blood vessels, though, using contrast in the vascular system. These four images show an aneurysm, a weak area in the blood vessel that balloons outward. The first image shows the area where the aneurysm lies as a white area. Image B is an angiogram of the aneurysm, and image C is the subtraction angiogram with the aneurysm clearly delineated. Image D is an MRA, magnetic resonance angiogram, colorized and rendered in 3D. This is an image of a subdural hemorrhage. The hemorrhage is brighter in the upper area and darker in the lower area. The brighter area is fresh blood and the darker area is older blood, so this is the second bleed into the same area as the first bleed. You can also see that the brain is pushed over to the side without the hemorrhage due to the pressure of the fluid. Multiple sclerosis is a demyelinating disease, so it affects the white matter of the brain. In this image, we can see the highlighted area along the white matter tracts of the parietal and frontal lobes. fMRI can image the brain at work. This is a colorized image of the activity of the brain, with red being most active and blue being the least active. In this scan, the person was shown several pictures to look at, so the active area was the occipital lobes. This image is an fMRI of a person using their working memory to solve a problem. Both the parietal lobes and the frontal lobe are the active areas in this process. This is an image of the same person, one when happy and one when sad. You can see that the areas light up differently for the different emotions. This last image is an axial section of a T1, a T2, and a contrast MRI of a single trichonosis cyst or neurocystic. This is an encapsulated worm in the brain with a significant amount of swelling around the cyst. The cyst contains the worm and several thousand eggs. This is an unusual finding. Typically, this is what we see in the patient, multiple cysts throughout the brain. In some, you can even see the worm inside the cyst. This ends the video on the MRI Gallery.